master of ceremony of today's session. Next slide.
Yes, ma'am.
Yes, yes, ma'am. So here we are. Welcome to our founder, patron, under the guidance of this Dr. Suvesh Narula Khanna, ma'am, advisory NSS, and under the guidance of Mr. Sandeep Karwasa, that is president of Lily chapter, and under their guidance, Scholar Society, we are able to conduct this webinar and celebrating a Midwifery Day celebration. And I would like to welcome special guest moderator, Dr. Bimla Kapoor, Senior Advisor, NSS National, and Professor Dr. Ashia Qureshi, ma'am, NSS National Advisor, and Neerja Sood, ma'am, as a chapter advisor of a Lily chapter. Next slide, please, ma'am. So this is the introduction of myself. That is, I am doing a Master of Ceremony and have done so many researches and publishing articles, and as a NSS member, I am a Lily chapter and also a joint secretary of this. And this is all under the guidance of a Narula Khanna ma'am and Binay Joy sir. Next, please. So here is the cultural and the historical glimpses of Bihar. That these are the basic diet and basic cities or the famous places in the Bihar. You can visit and have a look. Next, please. So today's special guest, chief guest, and guest of honor, Dr. Muthu sir, as a patron of a Forsythia chapter and a patron of assistant patron of a chapter president. And I would like to welcome that Professor Urmila Bharadwaj, executive member of NSS, guest of honor. And today's our special guest and keynote speaker, we can say, is Lieutenant Colonel and Ratinda ma'am, keynote speaker. She will going to present a topic on maternal satisfaction and fetal outcome. And one student from the MSc that we learned that after doing all these things, we should have some learning process, continuity of this chapter should get maintained. So we are on the process of having one student today speaker as a Ms. Khushi Tyagi, historical perspective and midwifery history she is going to present. Next, please. So this is, as we all know already, we have done all this done by under the guidance of Narula Khanna ma'am and Binay Joy sir. And today's executive members all are present here. That are Sandeep Karwasa sir as a president, and Sandhya Singh ma'am, and me myself Swati, and then Krishna ma'am, he has done Ratina ma'am, and these are all the members you are getting introduction. And lastly and most importantly is the Neerja Sood ma'am as a chapter advisor, and she has here as a good work. Next, please. So chapter, these members you can see, Sushma Charlie ma'am, Mahesh Gadak sir, that is chair peer review. These are all having a hall of conductee today and hall of fame of inductees. Then Sunita Kumari, that is chair cultural and education committee, and Ruma Chaudhary Bhattacharya. I would like to thank her to make this PPT and checking and doing everything on time. Then Lakshmi Prasanna ma'am as a mass mediator coordinator, and Neerja Sudha ma'am as a chapter advisor. So keynote speaker are today is Lieutenant Colonel and Ratina ma'am and Chair Bylaws, and guest of honor is Muthu sir and Urmila Bharadwaj ma'am. Next, please. So here is we are going for the digital lamp lighting. Before starting any program, we would like to always remember God. So we are having lamp light. Next, please. First, I would like to call Ms. Lily Chapter President. Under his guidance only, we are doing all this webinar and this. So I would like to thank you, Sandeep Karwasa sir, that, and about him, we are saying more and it's less only. So he is having impressive background in the Army Medical Corps since 2003. And he has completed General Nursing Midwifery and also Army Institute hold master degrees from the Bikaner University. Accumulated at a 21 years of experience and nursing also in the soldier field, served as a defense hospital across the country and holding different positions in ward master, dispensary in charge and administrative on all area, all perspective. He is working in the administrative clinical. He is a well-trained disaster management, actively participated in flood relief program, landslide response and earthquake relief effort. He engaged in the various operations near the international borders of Pakistan and China. Moreover, he is a familiar and weather conditions. Beside this, also they are working at the high altitude areas, and he received a numerous prizes and the commendations from the journal. And he is a skilled athlete who participated in national level in 21-kilometer walking away. Attended conferences and seminar both. So I would like to call Sir Sandeep sir for giving his message to today's event as a celebration of a midwifery day. Next slide, please.
Thank you,
Yes,
Swati ma'am.
yes, sir.
Good morning all to you. Very greeting to all. It's my honor and privilege to welcome our distinguished chief guest, our estimated guest of honor, our special guest, keynote speaker, student speaker, and the NSS patron and the NSS president. A heartful welcome to all attending. Join us for today's significant event. Today we gather to celebrate World Midwifery Day. Through this insightful webinar on the obstetric research in India, organized in collaboration with the Nursing Scholar Society. Midwifery, one of the oldest professions, has played a vital role in ensuring safe motherhood through the age. In India, it has grown traditional practice to a key pillar in modern maternal health care.
I request please mute your microphone. I request all please see your microphone.
Again, I welcome you all. Ma'am.
Amandeep ma'am, please mute yourself. Amandeep ma'am, please mute yourself. Sir, please go ahead, sir. Please go ahead.
Okay, sir. Thank you, sir. Good morning, all to you, respected dignitary, guest, and audience. I am President, Bihar Chapter. We are celebrating here World Midwifery Day. Here we are great time to induct some resource person and nursing leader in the Hall of Fame. I will see you later. Thank you. Over to MC ma'am.
Okay. So thank you, sir. Thank you for your valuable words. Now I would like to call Narula Khanna ma'am, Dr. Narula Khanna ma'am, for giving her message. Madam has received a doctoral degree from the international renowned Columbia University in New York and have a 45 plus years of experience, professional experience settings such as a teaching, clinical, administrative, research and management in 5 different countries. Life member of many national and international societies, and she has a chapter president of a Sigma Theta Tau International National Honor Society, also TNI Overseas Branch, USA, Canada. And she is a represented as a national representative in the United States of TNI, published extensively referred journals and authored one book and perspective of history in India, Indian leaders in the 1947 to 2000. That is the 3rd edition in press for printing. Then founder and seed giver patron of a CNRS, NHS and NSS. So, and also a patron of a NTS. So many, so awarded as a facilitated numerous timing, including recently in Surat, Rajkot, Harda and Delhi by various NSS chapters and societies. So I would like to call Narula Khanna ma'am for giving the message to this today's session event. So I welcome you ma'am, please.
Okay, thank you, MC Swati ji, and welcome to each one of you, all the dignitaries and respected our guests, and especially our lovely audience. My message is very clear and simple, that you all are here to celebrate our Mother Florence Nightingale's birthday, Nurses Day, and Midwives Day. So I'm so much blessed and honored that each one of you are here and presenting and are excited to be a part of our event. I would like to just play one minute videos, if you allow, about Florence Nightingale and
Yes,
nurses.
ma'am. Yes, ma'am. Please, please. Yes, ma'am.
Please go to next slide and just play that. Can you play that? Where is Ruma ji? She put all of these.
Ruma joined, but
She did it for me and I could see it.
Ruma, ma'am.
What happened to?
Yes, ma'am. Ma'am, just you click because I'm not sharing the PPT. So once you will click, you will get the video. Won't share it, right?
Krishna, ma'am. Please, once.
Click on the video, you will get. Or I have to sit with system because just now I completed my PPT.
We rehearsed and still it is same.
So we should wait, ma'am? Or
Yeah, just give her a second to get into that,
yes,
please.
ma'am. Yes, ma'am.
It was coming very nicely and I was so happy that we will play it now.
Atanu?
Rumaji, are you doing it or should we proceed?
Ma'am, you should proceed because I'm not able to do it because I am in mobile and I have to sit with computer because I finished my PPT just now and I sent it the latest one.
Okay, going forward,
Okay.
just when she comes back, we can play them.
Yeah.
It was only just a celebration and songs. It was courtesy of our
Yes.
Rudawat, who is a president of NOVA and Nurses Association of India, and has compiled all these little bits of video clips. So it was very nice. I give back to Swati ji and to proceed further.
Okay, ma'am. Thank you, ma'am. So
Yes.
due to some reasons, the video did not play, but it is showing the sign of our nursing profession and what we are doing. That is, it is a noble profession. The minor clips and certain history and background of our nursing history, midwifery, it shows. So with this effort, we can go proceed. Next, I would like to call Binu Joy, sir, NSS president. Next slide, please, ma'am. Next slide, please. Binu Joy, sir, Binu Joy sir is a gold medalist and currently working in principal in Rajkot, and he has returned plus 16 plus years of profession he is having involved in NSS mission and has conducted many national international workshops and proponent of the successful recent international conference and collaboration with Vibrant College of Nursing Surat. And he has published many articles, referred journals and authors and in the pediatric nursing. Lifetime membership in the prestigious professional societies and editorial board referred nursing journal, and he is a pillar of NSS society. I would like to invite Binu sir to give his valuable message on this. So welcome you, sir. Please, Binu Joy, sir.
Respected, a very warm greetings of the day. Respected Dr. Bimla Kapoor ma'am, Ish Qureshi ma'am, Sukhanna ma'am, Dr. Neeraja Sood ma'am, Urmila madam, President of the Sandeep sir, and all the team members of the BR chapter. First of all, I am very, yes, we are celebrating the Nurses Day and also the Midwives Day. First, deep in my heart, it pains that our 26 citizens who were martyred, who were because of the terrorist attack. So we can pay homage of 2 minutes silence on behalf of our citizens of India who were lost their lives. Sorry. Thank you very much. Actually, I recently visited Pelgam also just 1 week before the incident. So that was a deeply paining also because I visited there. I've seen the peoples were very calm, and really I've seen the Kashmiri peoples are of very good of love and nature, and it happens to them, and it's really painful situations that the peoples are facing there. Again, wishes of all the celebrations, midwifery celebrations. Yes, every citizen, we are our mother is our first nurse, and mother is also the first teacher. So we are in this world because of this, our beautiful mother, and we remember the mother also and midwives. Yes, they are truly great. We are blessed to see all of you together and all the seniors who have joined together for this event. Thank you and all. Thank you.
Thank you, sir. Thank you for your valuable words and giving a remembrance of painful attack with last some days we had in our nation. So thank you, sir. Thank you. Now I would like to call Dr. Neeja Sood, ma'am. Today is our chief guest, ma'am. She is PhD in public health with specialization in health system management, master in public health masters and community health nursing, BSc nursing in nursing, and diploma in the bioethics postgraduate diploma in distance education, MA in public administrative, that is FAI, MER fellowship. And professional experience is 39 years of experience, clinical, in which clinical is 1 year, and public health field, the distribution is accordingly that field is 7 years, and administrative training planning implementation is 12 years, and teaching at School of Health, IGNOU, as 15 years. Designing and implementation of nursing programs and open distance learning, discipline coordinator and program course coordinator. Contributions and the achievement: first registrar of the Delhi Nursing Council, consultant of Delhi government on nursing issues, team member for launching the Nursing Registration Information Management System, that is NRIMS in India. So this is a vast, I'm honored to call you, ma'am, to give a message to this session, Midwifery Day. Next slide,
Thank you
please.
so much. Thank you so much. Am I audible?
Yes,
Am I
ma'am.
audible?
So these are the contribution and achievements are also there. Ma'am is having so many best awards. Okay. Yes, ma'am.
Am I audible? Thank you so much for your kind introduction.
Yes.
Can I share my screen for a few slides?
Yes, ma'am.
If you can stop sharing this one, then I can share.
Yes, ma'am. Krishna, ma'am, please.
Yeah, first of all, thanks to Dr. Sue Khanna for inviting me as a guest. Thank you, ma'am. Always remembering me on some of the special occasions. And I'm really thankful to the Bihar chapter. You are doing lots of good work. And I wish all of you best wishes. Let me just share my screen.
Yes,
Is it visible, my presentation?
yes, ma'am. Yes, ma'am.
Okay. Actually, midwifery services in India, the concern, what I think, are nurses ready to take up the role, and opportunities are there? Are they given the opportunities? That is the basic crux. If you know the International Midwifery Day, the theme is that midwives critical in every crisis. This theme highlights the crucial role of midwives as first respondent in crisis situation, including any disaster, conflicts, impact of climate change, which is a concern of Government of India also. As we know, the midwives are vital of ensuring access to essential health services, particularly to women, girls, and gender diverse individuals during the challenging time. Government of India and Niti Aayog are actively promoting and supporting midwifery services and research by nurses in India. So we have to come forward to take up this role. Government of India, the National Health Mission has developed guidelines for midwife services, emphasizing on need for well-defined scope of practice for nurse practitioner, midwife, and a clear career progression. Still, the India is in progress of making a career progression and having a legal practice rules and guidelines. What is the role of a nurse practitioner and what are the legal protection for her? Niti Aayog had also highlighted the importance of strengthening the nursing workforce and has been involved in research and monitoring efforts to maternal and child health. Midwifery services are being enhanced through the development of midwifery units at various levels, as we know, even in the tertiary hospital, district, especially in the district level, district hospital, sub-district hospital, community health center. The IPHS guidelines, which were modified in 2022, gives the details about the labor room, space, and the human resource and the equipment and supplies which are required at these levels. Government of India guidelines emphasize the need for clear role definitions, integration of nurse practitioner midwife into the existing health system. As previously, the attempts have faced challenges due to ambiguity in the role and lack of clear pathway for the career progression. So this is the need of an hour. There is a need to integrate, to have a career progression for these nurse practitioner. Otherwise, they get demotivated after the training if they do not get a placement and the progression level is not there. Absence of a legal and regulatory framework has been identified as a major hurdle for the successful implementation of midwifery program. Efforts are underway to establish the regulatory framework, but this regulatory framework has to be very strong, very specific, because the scope of practice has to be defined very clearly. National Nursing and Midwifery Commission will aim to regulate and maintain standards of education and service by nursing and midwifery professionals, including the establishment of national and the state register. Already I have told you, Niti Aayog is playing a various crucial role and providing various opportunities also, because they have emphasized and recognized the need for increasing investment in the nursing sector to address the shortage of nurses and midwives in the country. It is a time for India to actually recognize the role of midwives. As we know, all of us are registered as RNRM. In future, the time is to take decision. Do we need a separate cadre, or from this same cadre, the nurses had to be trained and they will take up the role of a midwife. Midwifery model of care based on continuity of care, informed choice, and community-based approaches is being adopted to improve the maternal and child health care. And these are all the areas where research also can be done, because most of the students, even at the PhD level, take old topics. You have to come up with the latest, relate your research with the policy issues of the government so that the researchers can bring out the evidence. Yes, there is a need of midwifery model. There is a need for nurse practitioner midwife. And what are their boundaries to work, scope of practice? Unless we do a research, it is very difficult to bring in change. National Health Mission play a vital role in implementing the midwifery services. Niti Aayog, Poshan Abhiyan focus on improving nutrition and health outcomes, particularly among children and women, which directly relevant to midwifery services. I hardly see any research on these areas by the nurses, because nurses are in the field, in the clinical area. They can do these type of studies and bring out evidences. Pradhan Mantri Surakshit Matritva Abhiyan aims to provide comprehensive antenatal care to pregnant women, highlighting the importance of midwifery in maternal health care. In any state, if this program is been implemented, the evaluative studies can be done so that the role of a midwife, the role of a nurse as a midwife can be highlighted. Challenges in the future: establishing a comprehensive framework, legal framework to protect and guide midwives in practice, ensuring adequate career progression, addressing the shortage of skilled nursing and midwife professionals, because again, there is a brain drain towards abroad, because so many vacancies. Even I heard the nurses are going towards Israel also, because they are getting a very good package there. Then continuing investment in research and the adoption of evidence-based practice. This is actually the crux of bringing quality care and the quality in the maternal and child health, And nurses can play very important role if they're bringing the evidence and do research and improve the outcomes and improve the quality of the care. Midwives improve reproductive health and pregnancy outcomes for women, gender diverse people, and newborns. ICM essential competencies for midwifery practice. If you are interested, you can go through their website on 2024. The outline, actually, it outlines the minimum set of knowledge, skills, and professional behavior which are required for a midwife. These are very nicely, they have categorized in the 5 categories, and even the research in this area can be done. Are they represent these competencies in the pre-service education? If there is a gap, how this gap can be fulfilled. Transition of midwifery model care. The position paper is again released by WHO in coordination with ICM, UNFPA, and UNICEF. Anyone interested in this area can also go through this paper. This will give you a vision what type of model of care, midwifery model, not medical model, midwifery model of care is emphasized in this. A midwife is recognized as a responsible, accountable professional who works in partnership with women to give the necessary support, care, advice during pregnancy, labor, and the postpartum period to conduct the birth on the midwife's own responsibility and to provide care to the newborn and the infant. So the care involves all the aspects of the care, not only during delivery, but all the aspects. So thank you so much for providing me an opportunity for this. And I really appreciate the efforts of the Bihar chapter to take up such an important topic, which is the need of an hour. And I hope in future, Bihar chapter will also do some research in this area, which will be useful and which will bring in the evidence. Thank you so much.
Thank you, ma'am. Thank you so much. Yes, fine. Definitely, we will do some research in midwifery. And today, as today's topic is ops and research thing, so madam has told us very nicely, given the message of a ground level working of nursing, how they are working at a ground level, we are nowadays having in subject nutrition subject also. But we are not able to apply in the clinical area. So madam has given message that how we should apply this nutrition subject at the ground level so that we can get a nurse's role and we can focus on the government schemes has provided for the morbidity and mortality rate improving, mortality decreasing the midwifery and the infant rate in the India. So next we would like to call, next slide, Urmila Bharadwaj ma'am, and madam is having a 35 years in education and 6 experience plus 40 experience and 6 years in administration. Madam has served as a principal and dean in Sharda University as in the Rufaida College of Nursing, Zamia Hamdard. Ma'am, academic background include PhD in nursing education and community health nursing specialty with BSc from the AIMS New Delhi. Madam has received actively involved in the academic councils, NAC assessments, research guidance, IGNOU program coordination. Next slide, please. Madam has published extensively in the national and the international journal and several nursing textbooks. Her contribution to the community health and nursing education have earned multiple honor, including Lifetime Achievement Awards and Outstanding Service Awards, DGHS. Ma'am is member of leading professional bodies such as the TNI, NRSI, and Theta Tau USA. Has represented an Indian nursing education and clinical platform, including UK and USA. So madam has a vast experience and having so many years of professional, clinical, as well as academic and NAC assessment. So I would like to call Urmila Bharadwaj ma'am to give a message on this today's session of event.
Thank you so very much, Dr. Swati. I'm so delighted to be on this platform once again after a long time. My heartfelt thanks goes to Dr. Sue Khanna, who has so much confidence in me and who has given me this opportunity to be here. I'm also thankful to my mentor and my guides, Dr. Vimla Kapoor, my guide, mentor, and teacher, Dr. Ayesha Qureshi, Dr. Nirja Sood, and many of you, I know them in person. I know Swati for long. I know Krishnavani in some platform or other. So I'm very, very thankful to this. And NSS has done a great thing. And I pray to the Almighty God that this kind of organization, association, grow exponentially in future to care for the caregivers, which was a big thought of Dr. Khanna. Now, as we are talking about healthy beginning and hopeful future, we had been talking, WHO has been talking, everywhere it has been talked, in TNAI, ICN, everywhere we had been talking about it. When I come back to India, I see that India's maternal mortality rate was 2,000 per lakh live births in 1947. And in 2018-20, we have achieved it 97 per lakh live births. Great achievement, but it is not all. Because in developed country today, it is 5 to 15 per lakh live births. And as Government of India has announced that India will be developed country by the year 2047, we hardly have 22 years. So how will they reach that? That's a big question. But the commitment is really applaudable, and it is really, everyone has to work hard, especially the nursing professional has to work hard to achieve this. And we have not only the maternal mortality, the child mortality, newborn mortality, perinatal, all these are there. So I have jotted out some topics which can be taken, although the studies has been always done. I'll say later that these studies has been somewhere or other had been done, but as the demography changes, the people need changes, their socioeconomic status changes, they need to be done again, and generalization is one of the important things. So those topics are like research in nursing for improving maternal and newborn healthcare outcomes. Thousands of evidences are available. Unless we, research is only one time and you keep following it blindly forever. It has to be redone. It has to be re-authenticated so that the recent things can be included. So maternal mortality and morbidity, one can do investigating the causes, preventive strategies for maternal deaths. What were the causes earlier? They may not be today. There are different things. We have seen as the lifestyle of many professionals had changed. The multinational worker employees are working for a long hour, sitting for a long hour, and the infertility has become more of a problem now among young population today. So there are things has changed, the need has changed. Early warning signs for maternal complication like preeclampsia, APH, PPH, etc. Pain management, I feel the generation today doesn't have much of a tolerance. They don't want pain. I have seen hospital where I had worked in a labor room long back. It's not recent, but I saw elite group coming and they said, oh, give us something, give us a, epidural. I can't tolerate the pain. And the recent generation is much more, not wanting, can't tolerate the pain. So the pain management therapy, and we can have collaborative action, holistic action with various other acupressure or other things to reduce pain. Perinatal mental health is also important as the stresses are going on increasing, and there are various pressures on the couples, family, and everything. So the mental health screening, mental health care, and support system need to be reworked. I know there are a lot of studies done on mental health of prenatal, natal, and postnatal mothers, but it needs to be reworked that what is the need of today's population. Cultural competencies in maternity care, like addressing the disparities in cultural and ethnicities, their background has to be done. Improving communication between the nurses and the clients who are coming for care to us. Patient-centered, respectful maternity care. It is being talked last, I think, more than 10 or 15 years it is being taught, and many things are being done, but it has to be promoted. The reducing obstetric violence and improving dignity in care. During obstetric, there had been reported cases of violence during maternity. So that has to be reduced and more work can be done on that. Breastfeeding support and education. Nurse-led intervention is also done in many institutions, many places, which has shown, the evidence has shown that nurse-led maternity care, breastfeeding initiative, etc., has improved the mother and child health as a total. Use of technology in obstetric care, like we have telemedicine. Why don't we have telenursing? And why can't we have tele-obstetric care? Because in the remote areas, many a times they cannot come, or many a times they are busy. So why can't they, this small thing, they can always have a tele-nursing, tele-obstetric nursing that can come. That can be one of the study and can be actually launched to practice. Mobile apps, I know many people has done mobile app. I have also made one mobile app, but it is not being utilized so much. Although Delhi government has made a mobile map, Nirja ma'am would know that they had made a mobile map for immunization, and it is working. I've seen that they are working, but we can have a more mobile apps on obstetric care so that they are not worried. They can just see the mobile and take the advice accordingly. Emergency preparedness in obstetric units, that is a real training. Hands-on training has to be done. Simulators are available. Simulation exercises can be given to train them for emergency obstetric care. Response protocols for conducting simulators and other emergencies like code traps, PPH, and things like that can be taught to them. Preterm birth prevention, identifying high-risk cases. You can, even in the app itself, you can give a questionnaire to them and they can just tick it. I have this, I have this. So you can always find that who is at high risk. And midwifery in collaborative practice model. Midwifery has to really have collaboration with various other, disciplines like pain management, non-pharmaceutical management, as I mentioned earlier, acupressure, hydrotherapy. So many things are there which can be utilized. Integration of nursing, I'll say that more in detail. Integration of nurse midwifery into hospital system. That is something we can work on. There are a lot of researches done in the world around about nursing, which has proved that when nurses were given responsibility, autonomy, the health scenario has changed. Like there was a study done in California on maternal quality care collaboration, and it has changed the mortality rate from half between 2006 to 13. And Jean Watson theory, we all know that she has worked on caring